When you hear the word testosterone, what's the first thing that, jumps into your mind? For most of us, it's probably a flurry of stereotypes. Aggression, road rage.
Oh, absolutely.
Just general macho behavior. It's got this reputation as sort of the villain hormone. But we have to ask, is that reputation really deserved? Is it actually driving all that bad behavior?
It's almost entirely cultural noise, and that's a myth we need to dispel right at the top. The sources are really clear on this. The hormone's role in aggression is, well, it's vastly overstated. Testosterone is not some kind of ignition switch for bad behavior. It is, however, an incredibly complex and, frankly, essential chemical messenger. It governs health and strength in ways most people just never realize.
So that's our mission for this deep dive then, getting past all the brawny stereotypes and exploring what this hormone truly does. We've got sources covering everything from, surprisingly, its necessity for women to its very complicated relationship with prostate health.
So to start, let's just define the player here. Testosterone is a major sex hormone, an androgen. And like all hormones, it's basically a chemical messenger. What's so fascinating, though, is how tightly the body controls its production.
That control system is genuinely astounding.
Yeah.
It feels like, chemical engineering perfection. Walk us through how the body keeps that level so precise, especially in men, where it's the dominant hormone.
Well, it's all managed by this incredibly sophisticated command center.
The brain.
The brain, exactly. Signals go from the brain down to the pituitary gland, which then signals the testes to produce testosterone. But the truly elegant part is the feedback loop.
Okay.
Think of it like a thermostat for your hormone.
A hormonal thermostat. I like that.
Exactly. When the T level in the blood hits that perfect spot, the brain immediately recognizes it. It senses that saturation, and it sends messages right back to the pituitary saying, okay, throttle back, we have enough. This continuous loop ensures that the levels stay within a really narrow, tightly controlled window.
And it's synthesized from cholesterol, which is a great piece of trivia. But because of that feedback loop,
right,
having high cholesterol doesn't mean you'll just naturally have high testosterone. That gatekeeper is just too diligent.
That's it. The body prioritizes balance and control over, the availability of raw materials. It's precision engineering at work.
Okay, so if the body goes to all this trouble to deliver this precise dose, what's it for? Beyond the stereotypes, what does this hormone actually do for men?
It's really the architect of masculinity, especially during development. We see its impact everywhere. The physical development of the penis and tests, the deepening of the voice during puberty, and of course, the growth of facial and pubic hair.
And we're talking about core physical capabilities too, not just appearance.
Oh, absolutely. It's critical for muscle size and strength, for maintaining bone density, and it drives key sex functions, libido, sperm production, and there are subtler functions too. Sources suggest it's important for maintaining a normal mood, energy, maybe even cognitive functions we're still just learning about.
And when you look at what happens if an adolescent boy doesn't have enough T, that list of problems is pretty stark.
It paints a very clear picture of just how necessary it is. If testosterone is too low during puberty, those secondary sex characteristics just don't develop normally. You might see very little facial or body hair, genitals that don't enlarge fully, a voice that never deepens. It shows you this hormone is not optional. It's fundamental.
Now, here's where we hit that first real surprise for a lot of people. The idea that testosterone is also necessary for women. Most people just file this hormone away as strictly male, but that's just not the case.
Not at all. It's definitely not a male-exclusive hormone. In females, it's produced in smaller but still essential quantities. The ovaries and the adrenal gland both make it. It's one of several androgens, or male sex hormones, that women possess, and they absolutely need it.
So what's its role then? What does this male hormone do in the female body?
Primarily, it's a critical counterbalance. We know it has really important effects on ovarian function. And just like in men, it's vital for maintaining bone strength. It also seems to be linked to sexual behavior, specifically a normal libido, though the evidence on that is still being investigated pretty heavily.
So the key isn't just that women have it, but that the proper balance between androgens like T and estrogens is what keeps the whole system running.
That's the crucial element, balance. The right ratio is essential for normal ovarian function. And if we look at the brain, there's growing evidence that androgens play this quiet but important role in normal brain function, mood, sex drive, maybe even cognitive function. It's part of the whole picture of well-being.
This is where it gets really interesting, because now we need to talk about when that balance is thrown completely off, the effects of having too much testosterone, especially artificially.
Well, we should first say that naturally occurring high T in men is actually quite rare because of that tight feedback loop we talked about. Most of what we know about the dangers of high T comes from people, often athletes, who use anabolic steroids to just massively boost their levels.
Right. Way beyond what the body would ever produce.
Far beyond.
And the list of side effects from that is long, but what's so striking is the irony of it all. You're taking this hyper-masculinizing drug, but it ends up leading to some very anti-masculine results.
It's the ultimate counterintuitive finding. When you introduce massive amounts of external testosterone, it signals the body to just completely shut down its own system. This results in shrinking of the testicles, low sperm counts, and surprisingly, impotence.
Wow.
They get these huge muscles at the expense of their own reproductive function.
I mean, that's a huge price tag. And beyond the reproductive system, what are the life-threatening dangers?
The dangers are systemic and they are severe. Heart muscle damage, increased risk of heart attack, liver disease, prostate enlargement.
So it hits every major organ system.
Pretty much. High blood pressure, high cholesterol, severe acne, fluid retention, insomnia, and major psychological effects. We're talking intense irritability, impaired judgment, even delusions. These aren't minor side effects.
Turning to women, what's the most common natural cause of testosterone excess?
That would be polycystic ovary syndrome, or PCOS. It's a very common endocrine disorder affecting maybe 6 to 10% of premenopausal women, and it's characterized by those elevated androgen levels.
And what are the defining symptoms of that naturally high T in women?
You'll see irregular periods, which can lead to reduced fertility. You also see the physical signs, things like excess or coarse hair growth, sometimes male pattern baldness, and metabolic issues like weight gain. Mood issues like depression and anxiety are also really common.
And in the more extreme cases, from disease or maybe drug use, what are the most obvious physical changes?
Women might experience a decrease in breast size and a permanent deepening of the voice. And on top of that, many of the same systemic health problems men get from excess T. The good news is that for PCOS, the symptoms can often be managed, sometimes with medications like spironolactone, which is a diuretic that helps block the effects of those high androgens.
Okay, that covers the too much side. Now let's pivot to deficiency low T, which is a huge topic of conversation, especially for aging men.
It's highly relevant, yeah. And it's critical to understand that this is a gradual process. It's not like the rapid drop in estrogen that defines menopause. Testosterone levels decline really slowly, about 1 to 2% a year after age 45.
What are the biological mechanisms there? Is it just that the testes are producing less?
That's part of it, yes. The testes do produce less over time, but the second, and you could argue more complex part, involves the liver and a substance called sex hormone binding globulin, SHBG.
SHBG. Okay, this is a key detail. Why does this protein matter so much?
SHBG is like protein taxi. It binds to the testosterone that's circulating in your blood. But when T is bound to SHBG, it's biologically inactive. Your cells can't use it.
So it's locked up.
It's locked up, exactly.
I
As men age, the liver produces more and more SHBG, which means even if your total T levels look okay, the amount of active or free testosterone available to your body drops significantly. This can lead to low T in over a third of men over 45.
So you've got less being produced, and what is being produced is less effective because it's being hogged by SHBG. What does that gradual decline feel like?
The symptoms are often subtle and nonspecific, which makes it really hard to diagnose. Physically, you might see reduced body and facial hair, a loss of muscle mass, decreased libido, maybe impotence, and surprisingly, things like increased breast size and even hot flashes. Mentally, men often report just a generalized weakness, low energy, irritability, poor concentration, depression. And a big one is increased fracture risk because of the loss of bone protection.
Just to close the loop on deficiency, women can also experience low T, right?
Correct. Women might face it due to issues with their pituitary or adrenal glands, or sometimes after surgical removal of the ovaries. And the symptoms, well, they echo some of what men experience. Low libido, reduced bone strength, mood issues like poor concentration or depression. We also see that estrogen therapy in women can actually increase SHBG, which, just like in aging men, indirectly lowers their available free testosterone.
So what does all this mean for treatment? When is testosterone replacement therapy, TRT, actually appropriate?
Well, TRT is clearly approved for men with established diagnoses, things like delayed male puberty or a definite malfunction in the testes, pituitary, or hypothalamus that leads to low production. There's a known cause.
But the sources we looked at highlight this massive controversy around just using TRT for aging symptoms.
That's the minefield. A lot of men with perfectly normal T levels experience these same symptoms: weakness, depression, low energy. A man might be eligible for TRT if they have significantly low levels of active free testosterone and matching symptoms like disabling frailty. But without that clear biochemical marker, it's just very difficult to prove the symptoms are hormone related.
And the elephant in the room with this treatment is always the prostate. We have to talk about T therapy and prostate cancer.
This is maybe the most critical nuance in the whole conversation. Testosterone can stimulate the prostate gland and, crucially, any existing prostate cancer cells to grow. This is why a standard treatment for prostate cancer often involves T-lowering drugs like leuprolide to basically starve the cancer.
But TRT itself doesn't cause the cancer. That's a really important distinction, isn't it?
It is essential. The consensus is that TRT does not cause prostate cancer in men who don't already have it. However, because it can act as fuel for existing cancer cells, men at higher risk, or those already diagnosed, have to be monitored incredibly closely by their doctor before ever even considering it. It's a risk you have to manage.
Can you give us a quick rundown on the most common side effects of replacement therapy?
Sure. Acne, disturbed breathing during sleep apnea swelling, or tenderness in the breast tissue, and some swelling in the ankles are all pretty common. Doctors also have to closely monitor a patient's blood, specifically for high red blood cell counts, because too many red blood cells increases the risk of dangerous clotting.
So, synthesizing everything we covered today, what is the bottom line on hormone replacement?
The benefits usually outweigh the risks only for those men who have demonstrably low levels of free testosterone and a clear set of symptoms that correlate with that deficiency. For every other man hoping to treat, generalized aging or fatigue, the decision has to be a very careful, shared conversation with a doctor. You have to weigh the potential benefits against all the known risks.
So what we've really learned is that testosterone is so much more than its stereotype. It's an essential, precise chemical messenger that men and women both need in the right amount to function normally. But defining what that optimal amount is outside of a clear disease state is obviously still a medical frontier.
And that difficulty is why testing is so nuanced. You can check total T levels with a blood test, but because levels vary so much throughout the day, they peak in the morning, interpreting that result is really challenging. The recommendation is to measure free testosterone and to do it in the morning. If that level is low and you can replicate it on a repeat test, then you can begin that careful, symptom-based conversation about therapy.
Okay, so the brain uses this exquisite feedback loop to stop testosterone from ever getting naturally high, protecting the body. So here is a provocative thought for you to carry forward. Given the wide and severe consequences we see in people with artificially high T-heart damage, impotence, liver disease, what does that tell us about our body's own protective mechanisms and the sheer risk of bypassing that natural, hardwired regulatory system? Something to consider the next time you hear someone talking about performance enhancement.